Do you know what placentophagy is? If you do, share your answer in the comments section below. We will reveal the answer at the end of the video, and if you got it right, your name will be mentioned in our next video. Now, let's talk about something incredibly important: labor and delivery. If you are pregnant for the first time, you're probably filled with questions, concerns, and maybe even a little bit of fear. What exactly happens during labor? How do you know when it's time to go to the hospital? And what can you expect as you prepare to meet your baby for the first time? Stick around as we will answer all these questions and more in this video on labor and delivery. When will labor begin? When will I know it's time to go to the hospital? This is one of the most common questions from first-time moms. Labor is divided into 3 stages, and early labor might be easy to miss because it can feel like mild cramps or back pain. Signs that labor has started include regular contractions, water breaking, or the presence of a pink or bloody discharge called the bloody show. These signs signal it's time to head to the hospital. The early signs of labor have been observed and recorded across all cultures. For most moms, the process begins at 37, 42 weeks of pregnancy, as the body readies itself for birth. Make sure to stay in close contact with your healthcare provider as your due date approaches. Keeping a record of contraction timing can also help you identify when labor has truly begun. It's always helpful to practice breathing techniques to stay calm. How long do I have to be in labor before baby is born? A common question first-time mothers have. The duration of labor varies, often lasting 12 to 24 hours for first-time mothers. The initial stage, with gradually intensifying contractions, is the longest. Active labor and delivery stages tend to progress more quickly. Historically, labor was managed at home with midwives. Today, modern medicine offers resources for safe deliveries, whether at home or in hospitals. Most prefer hospital births for access to immediate medical assistance if needed. Understanding each phase of labor through childbirth education classes can empower you. Having a flexible birth plan based on medical needs helps you feel more in control during the process, ensuring a safer experience. Let's talk about 3 stages of labor. Stage 1, your body prepares by opening the cervix through gradually stronger contractions. Stage 2, the big push begins and you help bring your baby into the world. Stage 3, the placenta is delivered, completing the process so you can focus on your newborn. How will I manage the pain of labor? Every mother's experience with pain during labor is different. Options include natural techniques like breathing exercises and hydrotherapy, alongside medical interventions such as epidurals or IV medications. Discuss preferences with your provider. Do you know what an epidural is? An epidural involves placing a small tube near the spine to deliver pain-blocking medication. It allows mothers to remain awake and alert during childbirth, reducing pain while still participating in the birthing experience. Pain management has evolved, offering mothers various options to match their comfort levels. Discussing pain relief preferences with your healthcare provider ahead of time can ease decision-making during labor. What happens during delivery itself? This is called the second stage of labor and is often the most intense. During this stage, your contractions will help move the baby down the birth canal, and you will be asked to push when the time is right. Medical teams provide support, ensuring the safety of both mother and baby during this crucial phase. In hospital settings, a baby's heart rate is constantly monitored during labor, and the medical team takes any abnormal heart rate and rhythm seriously. Why? Because the heart rate of a baby who is not yet born often reflects the baby's overall health and well-being. It's one of the most important signs the medical team monitors during labor. By keeping an eye on the baby's heart rate, they can detect signs of distress, allowing them to respond quickly if needed. In ancient times, women were assisted by family or midwives during delivery. Today, medical teams guide mothers on when to push and when to rest, with the goal to push when uterine contraction is happening, and relaxing with deep breathing when contraction stops, using supportive breathing and positioning to facilitate a smoother delivery. What should I expect right after my baby is born? After birth, skin-to-skin contact helps regulate the baby's temperature and breathing. After birth, the baby will be placed on your chest for skin-to-skin contact if possible, meaning if the baby does not need any intervention. If the baby does have signs of distress, the delivery team will move the baby to a resuscitation table immediately for timely interventions. Remember, the first few minutes of life after birth can be a life-changing event for a newborn. Therefore, delivering the baby at a facility where a person with newborn resuscitation skills is very important. If the baby does not need any immediate interventions nowadays, most babies will also get something called delayed cord clamping. Do you know what delayed cord clamping is? Delayed cord clamping is when, after a baby is born, the doctor waits a little while before cutting the umbilical cord. The umbilical cord connects the baby to the mother, and it still contains blood full of oxygen and nutrients right after birth. By waiting for about 30 seconds to a few minutes before clamping and cutting the cord, this extra blood flows from the placenta to the baby, giving them a boost of iron and helping with their development. It's a simple step that helps babies start off a bit stronger. Do you know what the third or final stage of labour is? The third stage of labour is the final part of giving birth right after the baby is born. In this stage, the focus shifts to the placenta, which is the organ that provided the baby with nutrients and oxygen during pregnancy. After the baby is delivered, the placenta naturally separates from the wall of the uterus and is pushed out. This process usually takes a few minutes to half an hour. Doctors or midwives may gently pull on the umbilical cord or massage the mother's belly to help the placenta come out. Once it's out, the birth process is complete and the uterus begins to contract to reduce bleeding and help the body recover. Postpartum care ensures the health of both mother and newborn. Skin-to-skin contact is vital, and accepting help from the hospital team aids recovery. Staying hydrated and resting are crucial during this period. Now, as promised in the start of the video, let's talk about, if you guessed right, what placentophagy is. Placentophagy, the practice of eating the placenta, is rooted in some cultural traditions, believed to offer benefits like mood improvement and energy boosts. It's important to note the lack of scientific evidence supporting these claims. While some believe placentophagy promotes milk production, potential health risks exist. Recently, placentophagy has gained attention as some new mothers choose to have their placenta processed into capsules or tablets. After childbirth, the placenta is cleaned, steamed, dehydrated, and then ground into a fine powder. This powder is packed into capsules, making it easy to take in controlled doses. Proponents believe these capsules offer nutritional and hormonal benefits, potentially aiding postpartum recovery. However, there are risks. The placenta can carry bacteria or toxins that, if not handled properly, may lead to infections. Furthermore, while the practice is popular in some circles, scientific evidence supporting its benefits is limited, and its effects on hormones may vary, with potential for hormonal imbalances or even adverse reactions. Always consulting a healthcare provider before considering placentophagy is essential to ensure it aligns safely with one's health needs. Finally, put the names of animal species where placentophagy is observed in the comments section. As we conclude, remember to like, share, and subscribe if you found this video helpful. Your support enables us to create more educational content. Stay tuned for our next video, where we'll acknowledge notable mentions who commented correctly about placentophagy. Thank you for joining us on this journey through labour and delivery. We hope this guide has answered your questions and eased your concerns. Wishing you a safe and joyful experience as you welcome your new baby.